Hi, I'm Dr. Mary Balliet. I am the co-founder and chief science officer of Potential Power Nutrition. My special guest today is Dr. Elena Acquista Treaster, who has a master's in applied clinical nutrition, as well as being a chiropractor, and she teaches anatomy and physiology as well. And so we're here together because she has her special health story to tell us and how she went about diagnosing and getting a great treatment and recovering from a serious health crisis. So, Dr. Elena,
Good
what
morning,
would you
Dr.
like to
Bailey.
say with that?
Thank you so much for having me today, and I appreciate your willingness to allow me to share my story so that this will help educate my fellow chiropractors and hopefully encourage them to perform the thyroid exam that we all learned in chiropractic school on their patients. And the thing of it is, I think we can have a dramatic effect on our patients' lives. It only takes 5 minutes, and we only have to do it once a year.
That sounds great. So, how did you get interested in a thyroid exam? What made you decide, oh, I think thyroid exam is the thing that really got me interested in studying more anatomy and physiology?
Well, it all was my own personal story. I've always believed that us as chiropractors, we are like the first line of defense for our patients. I've always believed that. I've never seen myself as totally a musculoskeletal doctor. Never believed that. I always thought that I was there as kind of like the first line of defense to refer my patients out into where they need to go as far as their health care. And so there was a semester in between my eighth trimester and my ninth trimester where I was actually diagnosed. But here's the kicker. I could have been diagnosed a year before, had my lab partner in one of the physical assessment classes when we were learning about the thyroid gland, if he had palpated my throat, because it was big then and it got even bigger a year later. But he actually refused and said he would never use this in his practice. And I'm like, if he only knew the effect that he had on my health because he didn't perform that exam. Thyroid cancer is insidious. It has no symptoms. Most people are walking around and they don't even know that they have it. So again, my whole purpose of this is just to spread awareness, spread my story so that if I put that little bug in a doctor's head saying, oh, I should palpate their throat, my patient's throat, then I've made a difference.
Wow, that's really inspiring. Um,
I,
eh,
I hope so, because again, it's just trying to bring awareness and to help our patients because that's all we want to do.
yeah, and did you know anything was wrong before they did the exam where they did palpate your throat?
No, I did not. In fact, it was actually just dumb luck that I was diagnosed. And I will remember this day as long as I live because it was actually my brother's birthday. And I was going down to my allergist who's in Pennsylvania, and I was in Western New York. And I was going, and he had the day off. And I go, hey, Aunt, do you want to go for a ride? I was like, we'll go for lunch after my doctor's appointment. We'll just spend the day together. And he was totally for it. And so we did. And so we got off and we went on our journey. And we got to my doctor's office. I gave him my car keys. I'm like, go explore town, come back for me in a couple hours. So then I was sitting with my doctor and I was just telling him, how school was going and how I was feeling and getting refills on my scripts. And I wasn't going to say anything, but because I thought it was in my head, I was just tired. I was always tired. But I was like, come on, I'm in chiropractic school. And then I had started the nutrition program and I was already 2 semesters in. And I'm just like, it's just school. But then I heard this nagging voice. I heard somebody screaming in my head. I don't know if you've ever had that before, but
Sure.
it goes, tell him. I'm like, okay. So I go, Doc, it's like, I'm tired. I'm always tired. And I thought he didn't hear me. I thought he was just writing down notes. And then all of a sudden he turns around and he palpates my throat and he goes, "Did you know your thyroid is enlarged?" And I'm like, "What?" And I'm like, and I'm sitting there, it's like, "What's the thyroid again? What does it do?" I couldn't even remember what it does. I was so stunned. And so that's how the ball got started. And
Just a routine physical at your medical doctor's
mhm,
office.
yes,
And so we do, as chiropractors, we do a patient exam and assessment each time, and so easy
yes,
to do that exam. Besides him
yes.
palpating your thyroid, what other tests then got ordered for you?
The first thing he did, he goes, "Before you leave the area, there was a local hospital." And he goes, "I want you to go to the hospital, go get blood work." And I'm like, "Okay, I can do that." So I told my brother, "Hey, before we go get lunch, I gotta go get blood work done." And he's like, "Totally cool." We had the whole day together. So I went for blood work. And then he also sent me home with a script for a thyroid ultrasound. And he goes, "Within the next couple days, get this done." I'm like, "Okay, doc, I could do that." So when those came back, the funny thing is that my most of my thyroid markers, even though they were on the low side of normal, they were all normal.
Huh.
So my TSH, my free T3, my free T4, my total T3, reverse T3, all normal. In addition to that, we also thought it might be autoimmune, but it wasn't. I had no antibodies to the thyroid globulin or to the TPO or the thyroid peroxidase, none of that. So we knew it wasn't autoimmune. But what did come back was that my thyroid globulin blood levels were out of this world. They were 925 nanograms per milliliter, and they should be between 2 and 35 nanograms per milliliter. And that right there is a hallmark sign for thyroid cancer.
Wow.
So that was the first thing.
So
And
then,
then,
go ahead.
yeah,
Then you had your ultrasound after that.
yeah. And then I had my ultrasound and that revealed, he called me up and told me, he goes, "Well, I got the results for your thyroid ultrasound." And he said, "You have a 4.9 centimeter mass in the right lobe of your thyroid." And I'm like, "What?" Again, I'm stunned. I'm like, I couldn't believe it. But it actually started to make sense to me because while I was in chiropractic school out in Seneca Falls, and by this point, I was back in Buffalo at the DePuy Clinic doing my clinicals. It made sense to me because that I was having this issue because I could not hold my cervical adjustments. I could get adjusted and 5 minutes later, my neck would be out again, which made sense because I had this mass growing in my throat. And I figured, okay, that's like putting pressure on that cervical spine. It's like, no wonder why I couldn't hold it. So it made sense to me.
That's really interesting that that was your basically just mild fatigue or regular fatigue, but you were in
Mhm.
school and now you have
Yes.
this can't hold the adjustment. Other people who have other things could be ligament
Yes.
laxity, or they could just be
Yes.
having all this stress at the computer. It could be other things that could cause that. And
Yes.
yet this was the cause for you and it didn't get diagnosed
No.
even while
That,
you were at school.
yeah, that's why I said it's insidious because most people, like 90% of the people, don't show any symptoms. They don't know they have it. So they're all walking around. And then
Oh.
based on the ultrasound results, I get the phone call from the doctor. It's him personally calling me, and he's going, "Okay, you got the mass. We have to take it one step further. I'm sending you a script for a radioactive iodine uptake scan." And I'm like, "Okay, doc, I'll do it." And within a week later, I had it scheduled. And with that, there's a couple of different ways of doing it, but with this hospital that I went to, they gave me a radioactive iodine capsule.
Right.
I swallowed it. And then I go home, you wait for 24 hours, and then you go back, and literally it's 24 hours on the dot. And I went back and they did the scan. And then they reported the results back to my doctor.
And so it showed a really high uptake of the radioactive iodine.
Not high, low. So what happened
Oh,
is it was low in my right lobe, and this is what they call, quote, a cold lesion, because it
Oh,
didn't take it up. And iodine, the thyroid needs iodine to make the thyroid hormone. If you don't have it, you don't make it. Um, so that just showed them that, okay, the tissue is so altered, it can't even use the iodine. And so because it's a cold lesion, again, that was another indication that it was thyroid cancer and not something else. So yes, it's a cold lesion, not a hot. So the left side was hot. It was there, you could see it. But when you look at the right side, it's cold and you could hardly see the outline of the right lobe of the thyroid.
so in other words, your left lobe was completely taking over for all of your thyroid function, allowing
Yes,
you to stay normalized when the right side of your thyroid was effectively not taking up any of this iodine, not making any thyroid hormone, and yet somehow you stayed relatively normal.
that is correct. The left side was doing it all.
Wow, that's super interesting. And then once you had this diagnosis, what was the treatment that they suggested?
Well, what I think was funny was, I think it was like about a week or two later, doc calls me back and he tells me the results of the test, and he told me he thought it was thyroid cancer. And are you ready for this? This
Yes.
was 2 days before I took my part 4 boards. He called me personally and said, "You got to get this taken care of." And do you know what I told him? I was like, "I don't have time for this. I don't have cancer. I'm not dealing with this." And he's like, you gotta take care of this. And I'm like, "Doc, listen, I don't have time to hunt down a doctor in the Buffalo area. I don't know who's good." And he goes, "Well, you got a nice cancer hospital right there." I'm like, "Oh, heck no, I ain't go there." I was like, "Doc, I trust your judgment." And I said, "Please refer me to somebody in Pittsburgh that I can go to. I trust your judgment. Just please take the guesswork out of it for me so that I can concentrate on studying for my boards." And so he did. He called me back and he referred me to a surgeon at the University of Pittsburgh. And a week after I took my part 4 boards, I was in Pittsburgh talking to the surgeon, and he gave me his recommendations.
And so what kind of surgery did
Mm.
they suggest?
They wanted to do a total thyroidectomy based of the nodule itself, the size of the mass. And I'm like, I was hesitant, and I'm like, "But you can't prove to me there's cancer in the other side." And it's like, I need thyroid. I need my thyroid. I mean, not only does it make thyroid hormone, but it also makes calcitonin, which plays in calcium homeostasis. And I was like, and I didn't quite understand how they were going to, if they took it all out, I didn't understand how they were going to treat both. And I'm just like, So I had to sit with it for a while. And he goes, "Well, while you think of it, we're going to do a biopsy." I'm like, "Okay." And so this was his thyroid clinic. So I had the biopsy done that same day. And so the endocrinologist comes in, and I have to laugh because I swear to God, if you would have seen the neurological exam that they gave me, I would have been kicked out of chiropractic school if I had done the exam that they did. They did. That's like, okay, this is, just Western medicine for you. But anyway, so he says, "Oh, the biopsy is no problem. We can do it right now. You don't need anesthesia, because it's not painful. Everybody does well with it." And I'm just like, okay. So I took his word for it. And I was like, I should not have. So if a doctor tells you it's not going to hurt, don't believe him. Take the anesthesia. So anyway, so they put me back in the room, and then they lay you down, and then they put a pillow under your neck because your neck has to be in extension. And then they use an ultrasound to guide the needle into the mass to gather cells. And for the most part, it went well. And they had to keep on taking samples and samples and samples because it kept on coming back as what's the word I want to use? As undetermined. By looking at the cells, they couldn't tell it was cancerous or not. And then and that was in the large nodule. And then they wanted to hit up a smaller nodule near my clavicle. And when they did that, jumped off the table And I said, I'm done. And then I was like, I can't do this anymore. It was too painful. I was like, okay, I'm done. And they agreed. But I had to go back for a second one. And I said, well, I'll come back for a second one, but you're going to have to use anesthesia. So I tried to be a cooperative patient. So I did end up going back for a second one. And this time they did use anesthesia, but the same thing happened where they kept on taking sample after sample after sample, and it kept on coming back indeterminate. They couldn't tell if it was cancerous or not. But based on the size alone, the surgeon said he was confident that it was probably thyroid cancer. So I decided, I struggled with this. I was like, do I take the whole thing out or not? I was like, they can't prove to me that there's cancer in my left lobe. So what I ended up agreeing to is just having a hemithyroidectomy, which is they only took out the half. So they only took out the right side. And then the surgeon said, well, if it turns out to be cancerous, then we can always go back and remove the left side. And I'm like, okay, fine. So that's what I did. I ended up having a hemithyroidectomy. And then a few days later, the surgeon calls back and he says that it was papillary thyroid cancer with a follicular variant. I'm like, okay, thank you. And I ended up, I know everybody's probably going to think I'm nuts, but I ended up deciding, again, because I couldn't get over the fact that there was no proof that there was cancer in the other side. So I went back to my allergist, and he said, based on the genetic profile, he wasn't worried about it spreading. I had one of the thyroid cancer genes. It was called the RAS genes, RAS, but
Yes.
he said it's not aggressive, so he wasn't worried about it. So he was willing to treat me and monitor me. And then should I need further treatment, then we would do it from there. So that made me totally happy. So I had the best of both worlds. I had Western medicine, and then also I could do like my nutrition and other things like that.
Wow, that is so cool. So you actually still have one lobe.
I do. I still have my left lobe of my thyroid, and I also have the isthmus too.
Oh, that's so cool. And then how often do you have to get it monitored then?
So my doctor actually ended up retiring. So there was about a year that I struggled to find a new doctor. And so I was out here in Arizona at that time. So I actually found a naturopath out here, and she agreed to take me on. I told her, I was upfront with her. So this is another lesson I wanted to get across to people, is that just be honest with your doctor. And if you don't fire them, you find somebody else who's willing to work with you. I was upfront with her. I told her I had thyroid cancer. I told her how my previous doctor was treating me. And she was totally cool to treat me his way, because for the first 6 years after my surgery, I was just being monitored. I didn't need any additional thyroid support. My left lobe was doing fine. Then all of a sudden in 2016, my thyroid levels took a nosedive, and I got tired again. And I didn't know why. And then my doctor calls me and he goes, how are you feeling? I was like, it's funny you mentioned that, doc, because I'm tired. So he goes, your thyroid levels plummeted. And I'm like, okay. And we couldn't, to this day, we don't know why. So he goes, I want to start you on some thyroid hormone support. So we first tried Armor Thyroid, and I actually had an allergic reaction to it. I am very sensitive. So I actually reacted to the dyes in it. So then he put me on compounded dye-free veggie capsule thyroid hormone, and I've been doing really well. And so I've been doing that. And the other nodules, because he liked to say my left lobe was lumpy, but he was happy to say that because I got on that compounded thyroid hormone, those nodules actually started to shrink. And that's because it took the stress off the thyroid gland. So he was happy to continue. And so when I told that to my new doctor, she was happy to do that. But she goes, I got another way of doing it too that's really effective. So again, I wanted to be cooperative. So I did try it her way. So I'm on a combination of compounded hormone and some T4. And it's actually working out really well. I just was saw her a month ago. My thyroid levels are good. And I also go for yearly thyroid ultrasounds just to make sure everything's good. And I think, between taking care of myself and having a doctor who's willing to work with me, I've been able to keep my left side. And that's always been a goal. I've wanted to keep my left side.
That is really exciting. What would you did you have to do any specific nutritional support since you've had this diagnosis?
The only thing I've really done is I try to watch what I eat. So anything that I know that aggravates me, like dairy, like dairy makes me sneeze and wheeze, so I don't do any dairy. And that's just a personal choice. And then also I've gone gluten-free because I know gluten can, it can, it fools the body and then you can develop Hashimoto's. And I'm like, well, I don't want that. So I've gone gluten-free. It was my choice. It was easy. And then I just also make sure I have an anti-inflammatory diet and then taking, supplements here and there. But when you came out with your potential power shake, I was amazed at all the thyroid supports you have in there. So you have the tyrosine, which is the building block for the thyroid globulin, which is the precursor for the thyroid hormone. You have iodine in there. You have selenium that is necessary for the enzymes to make the thyroid hormone. And I'm just like, this is perfect. So I got the best of both worlds. I'm taking the thyroid hormone support and then I'm also doing the nutrition as well. And it's all in one package. And
Thank you.
that's what I love. You're welcome. I was like, I am so glad you developed it.
Thanks. And then what would you say that I think we're really clear how you're spreading this awareness now to everyone in our network and anybody who's on our YouTube channel. What would you want to wrap up? How has this impacted you in your life as a healthcare provider, as a patient, as a person?
I think the most important thing that I've learned is I have to take care of myself because nobody else is going to do it. So that's from a personal level. But as a professional level, it taught me to really listen to my patients. Because I remember we had one instructor who told us that, number one, that if you listen to your patients, they'll tell you what's wrong. And it's true, they do. So I really learned to listen. I developed empathy because of how I was treated as a patient. I learned how I wanted to be treated and then also how I wanted to treat my patients. But it also taught me that I can make a difference in people's lives. And I have another story to tell. I haven't diagnosed thyroid cancer in an actual patient, but what I did do is I actually diagnosed it in one of my students.
Oh,
A couple, it was totally out of the blue. I didn't even know she was even concerned about her thyroid. I was teaching Anatomy and Physiology Part 2, and so we were talking about the endocrine system. And at the end of that particular section, I like to give case studies. And every once in a while, I will put my results in there. So I try to use real patients. So I put in my results from my blood work, my thyroid ultrasound, and the radioactive uptake scan. And then I ask them, okay, come up with the diagnosis, apply the information you just learned, and what does this patient have and what would you do for them? And so everybody would get it right. It was thyroid cancer. And then they would tell me how they would refer them to, like a surgeon or an endocrinologist. And I'm like, perfect. And then after they turn all their papers in, I'm like, congratulations, you just diagnosed my thyroid cancer. And they all look at me in shock because they can't believe like somebody who like me being young and being looking healthy that I would actually have cancer. And I was like, yes, I did. And so based on that case study, one of my students actually went to her doctor, and I still don't know why to this this day, why she did it. She actually went and told her doctor she wanted to get her thyroid examined. And so she did. She got her blood work done and she did an ultrasound. Now, she didn't show me the blood work, so I don't know what that revealed, but she comes up to me and she goes, Dr. Treaster, these are my ultrasound results. I don't know what they mean. And I'm just like, well, didn't your doctor go over them with you? And she goes, no. And her doctor was an endocrinologist who ordered this. And so I'm looking through them and I'm like, and again, because of my awareness and how I educated myself, I looked at them and she had a couple nodules over 1 centimeter. And the rule of thumb is if you have a thyroid nodule greater than 1 centimeter in size, it's considered cancerous until proven otherwise.
Correct.
And I'm just like, you have to go to back to your doctor. You have to request a biopsy as soon as possible. You have to get these checked. Her doctor didn't even tell her to do that. I was like, go do it. And she did. And then she comes back and she told me after the biopsy, she was diagnosed with papillary thyroid cancer. And so she had the surgery. And unlike me, hers actually spread to her lymph nodes.
Oh,
So I'm just like, I was like so grateful she came to me because we got it before it spread any further. And if we remember our thyroid anatomy, it's highly vascularized. There's a lot of lymphatic vessels there. And I just like to think that, wow, that is one heck of a highway system for cancer cells to go and travel throughout the body and spread. So I'm glad we caught it really early. And that was like one of the things I wanted to tell my fellow colleagues is that if we catch it early before it spreads to distant parts of the body, it has a 98% 5-year survival rate. It's highly curable. Okay, it's slow growing, it's highly treatable. Treatments are very effective. We can make a difference in our patients' lives.
yes, I totally agree. It is because I look at people's necks all the time and all the years of practice. It is something that I'm always sending people to the endocrinologist for if I see anything abnormal at all. And so I'm going to just totally back you up on all of this. Absolutely necessary. And as we wrap up, I just want to thank you first for sharing your story and how exciting it is to know that we're making a difference in patients' lives, and for all of the great care you've given your patients and all the students you have taught and all of the other people that you have influenced when you were my student. Like, it's just very exciting for me to see you blossom into this amazing healthcare provider as well as faculty member. So I'm very touched by your story.
Well, thank
For
you.
sharing.
I just remember the support that I got from you and for my fellow teachers, but then also too is my fellow, there was a couple of my classmates that they were there for me, and I know you know who they are. They were there for me. They literally kept me calm so that I could, everybody always asks this, they want to know, did you pass the Part 4 boards? And the answer is yes. And I attribute that to my friends who helped keep me calm. And they just told me, they said, hey, look it, you can't do anything about it. And it's like, oh yeah, you're right. But they said, you can do something about passing these boards. And I was like, yes, I can. So yeah, they kept me calm. They kept me centered so that I could concentrate on what I needed to do.
As they say, it takes a village.
Yes, it really does.
Well, I really appreciate this. So to the network, I hope that you enjoyed this. And if anybody else wants to reach out and share their personal health story so that we can inspire other doctors to help their patients, please let me know. And if you need to get a hold of me, it's mballiet@potentialpowernutrition.com. And do you want to share your email if anybody has a question for you?
Sure. It's dremtreaster@gmail.com.
And you can
Please
reach
feel
out to
free.
me
Yeah,
and I
feel
can
free
get them
to,
in touch.
yeah, feel free to reach out, ask any questions. I'd be happy to share what I know.
That's great. I'm going to end this, and thank you so much
Thank you.
as I try to end this. And I so appreciate this.